Healthcare Triage Live as I lower the volume on my computer so you don't hear dinging. Were we live after? We were not live last Wednesday after the election. This is our first one after the election. Yay, election. Oh my God, the chair's breaking. Everything's over. It's all over. Anyway, yes, it's a whole new world here on everywhere. Where do we start? Let's start with question. Now let's go to our usual stuff. Anyway, now is as good a time as any to support healthcare triage. We're going to need in the future to have objective places to talk about health policy, health research, and health in general. And that's something we pride ourselves on. So if you feel inclined and you want to do some good post-election, no matter how you voted, consider supporting us on patreon.com. Patreon.com/healthcaretriage. It all goes directly to supporting healthcare triage to make this show as good as we can. We also have new merch. Some of it for the holidays. HCTmerch.com. There's a lunchbox. It's very cool. I can't wait to get mine. Facebook.com/healthcaretriage. That's just more like moral support or joining the community. We appreciate it. We're ready to go. We got lots of good episodes coming out. This Friday's news is going to be specifically on what Republicans might do or what actions might qualify as actually repealing Obamacare. We're going to, I'm sure, be talking a lot of health policy in the next year or two. It was funny, right after the 2010 election, right after 2010, after they wrote and signed the ACA into law, I remember musing to a colleague or two like, I wonder if the gig is up. Like, we've had a good run, but I guess this whole health policy thing is done. This whole discussion of healthcare reform's over. Wow, was I wrong? Even in the years that followed, but certainly now, my God. I'm sure we're going to be talking a lot of healthcare reform in the near future. And right here, if you guys give us your questions. So let's begin. David Devine. Is there a way within the current American healthcare system to disallow or prohibit a system of networks so that patients can go where they want rather than being constrained? Sure, but there's trade-offs, okay? You have to understand that, networks, setting up networks where if you go to certain doctors or certain hospitals, it costs you less, is the means by which private health insurance companies compete for your business and save money and lower your premiums. That is how they do it. That's like one of the tools available to them. If they can gather a big group of people and then go to some doctors and say, hey, we've got a huge number of beneficiaries here. We will steal them all to you if you cut us a break in your costs. And they do this to hospitals as well. They make a deal, then they pass that savings on to you. That's what allows them to have cheaper premiums. That's why HMOs, which have really constrained networks, are cheaper than PPOs where you have more breadth in what you can do. That's the trade-off. Cheaper premiums means networks. If you don't want networks, you got to pay more money because then there won't be these negotiated deals. This is one of the reasons why selling insurance across state lines is such a gimmick and a joke. Because if you buy a plan, for instance, in Indiana, it covers Indiana doctors because that's where the insurance companies, they made their deal in Indiana with the Indiana doctors. If in Texas you buy that Indiana plan because it appears to be cheap, it won't be as much use to you because there will be no Texas doctors. The big cost of setting up an insurance company or setting up plans in each state is setting up those networks. That's what they need to do. This is also why I'm somewhat skeptical about public options in various forms because they won't be able to set up those networks. All they can really do is just reimburse less, which has its own trade-offs and problems, and we've discussed that before. But the other alternative is just say go single payer. I mean, Medicare has an enormous network. You can go see almost anyone with Medicare. Very few doctors flat out refuse Medicare. Almost no hospital refuses Medicare. Almost every hospital is in network with respect to Medicare. So you can go that route. You can go, we just don't care, we'll pay whatever we want. But those are the trade-offs because you can't have everything. What do you want? What are you willing to give up for it? That should be like our healthcare triage mantra there. Another question. You've spoken before on how physicians, despite evidence, are slow to change their behavior towards best practices. Have there been studies to determine how best to change that behavior? Follow-up. Would checklists be a good stand-in to make sure doctors don't miss steps or bypass best practices? So most of the research that's been done is what you would imagine it would be. There's carrots and sticks. We try to change it through carrots by giving them more money. In other words, it's like that's what paying for performance is. That doesn't seem to work much, as we've talked about in many healthcare triage episodes. The other way is more of a stick. Hit them over the head, not literally. if they don't do what you want. That's penalties, the idea that we'll withhold payments if they make mistakes, or we'll withhold payments if there's readmissions. That also doesn't appear to work. So it's probably some combination. Problem is that these have got to be targeted. And we do not have a healthcare system that allows us to target stuff because we don't have a lever that says change all physician payments to pay for this, not that. We don't have it. We don't have a mechanism to say, like, implement all of these carrots and sticks in all hospitals nationwide. We don't have a centralized healthcare system. We have an incredibly fragmented one. And because of that, it's very hard to do this kind of stuff. Now, checklists are good in the sense that they get you to make sure you're doing the correct things over and over and over again. But you need buy-in. You need hospitals to want to do that. And so many of the studies that have been done are because hospitals or C-suites have said, like, we think this is important, we're going to implement this locally. Those are not like nationwide do these kinds of things. Lots of doctors don't do it. I have spent most of my career trying to use clinical decision support and electronic medical records to improve pediatrician practices, to get them more guideline-based. And I can tell you, it is hard. Doctors are often very resistant. They don't like to be told what to do, and it is incredibly difficult to change physician behavior. And so we do the best we can. Next question, and kicker. What do you expect the future of healthcare and health policy to look like for the next 4 to 8 years? Oh my God. Do we have like hours to talk about that? We're going to be doing many episodes on that. But look, here's the thing. There's no question that Republicans for a long time have said they want to repeal Obamacare. There's a number of ways they can do that. The first is to try to actually craft legislation to just repeal the law on day one. They can actually repeal anything, even with the filibuster in place. They can't just do a flat-out repeal unless they want to get rid of the filibuster. I don't think they'll want to do that on day one. They can, however, get a lot of stuff through reconciliation, anything that touches on the budgets. That would include the individual mandate, that would include the subsidies, that would include the Medicaid expansion. All of those things, have budget implications. Reconciliation would work for that. They need 51 votes, they could probably get it. Although I don't think they will, because that would upend the system completely and they get a huge amount of flack for it. They can't, however, the reconciliation change a lot of the regulations like community ratings, and they can't change guaranteed issue, and they can't change putting people on your policies until they're 26, because a lot of that stuff has nothing to do with the budget. That's just how we regulate insurance. So I don't think they're going to just flat out repeal immediately. I think there could be a repeal and delayed replace kind of thing. In fact, I think I wrote a blog post today about it. But that comes with its own negatives. I think it's very likely Republicans are going to push for block granting Medicaid, and I'm sure we'll be discussing that in the weeks to come. I plan to write an upshot column on that in the near future. I'm sure we're going to be talking about Medicare reform. I don't know whether that's going to happen, because I don't know how much the president wants to do that, or the president-elect, I should say, versus how much Paul Ryan wants to do it. And of course, they could come up with a full-out repeal and replace. There's a lot of ways to replace the Affordable Care Act. There's a lot of plans out there. I talk about some of them in this week's Healthcare Triage News. But whether or not that's going to get done is questionable. Here's the truth. I have no idea what's in President-elect Trump's head. And I'm not saying that because I'm trying to be coy or silly, or because I'm making fun of him. I literally don't know what he wants to do. And I don't think many people do. I'm not sure he knows, because he said many things on the campaign trail that could be construed to mean that he's not going to touch Medicare or Medicaid, or he might touch Medicare or Medicaid, or that he wants to repeal the Affordable Care Act immediately, lock, stock, and barrel, or you know what, let's keep the good parts and get rid of the bad parts, which really isn't possible. Or he wants to replace it immediately, or you know what, this is going to take time, we're not going to do it. I don't know. We will be discussing it as more and more information becomes available, but it's just not clear at this time. Keep tuning into Healthcare Triage, though. I am sure I will be writing episode after episode after episode on what is being proposed, what is being debated, and what are the trade-offs about them. There's going to be a lot to talk about in the next year. Armin Hussein, I've heard that men experience vasovagal fainting more than women. Is there any evidence to that, or is it just something the nurses say to make guys feel better? Well, if it makes you feel better, I have fainted vasovagally many, many times in my life, and my wife has not. My son, Noah, all three of my kids either have or have come close. And that includes 2 boys and a girl. So look, one of them was like, when Jacob, my oldest, was like 2.5, maybe 3, and my middle child, Noah, was like 6 months. He was a baby still. Jacob fell down the stairs, came up against the gate, hit his head with a crack. I was sure he broke his neck. I did the absolute wrong thing. I picked him up, checked him out, he was fine, but that was enough of a shock, panic to my system. Then I knew I was going down. So I remember I handed off the baby to my wife, and I said, I'm going down, sat down at the kitchen table, passed out right on the table. Woke up to her on the phone with 911, at which point I'm like, I don't know why you called 911. I told you I was going down, but she didn't like that. Another time when we went to Mexico, I got a bit of the gastrointestinal distress, and I got so dehydrated that when the plane took off, I passed out, landed on my wife. She was very upset at me because she'd been asleep, saw I was passed out, freaked out, and I came to having my pulse taken by an airline flight assistant, and it was a nightmare. I've also passed out the first time I saw an epidural go in, because man, that needle was like this long, and it just kept going in and in and in. I passed out once because a guy was screaming in pain. Just his screams made me. I've gone vasovagal many times. There's nothing for you to be upset about if it happens to you. You know, your doctor may want to talk to you about it or check you out, but it is common. And I have even doctor friends, lots of them I saw last night, who've also passed out vasovagally in various instances. And these are like critical care docs and people that do stuff that's incredibly invasive all the time. I don't know. For me, it's like fear and seeing others in pain makes me go vasovagal. I've also passed out twice trying to donate blood. And they told me never to come back for that. There you go. Anyway, Nen Kicker, do soda taxes lead to long-term positive health outcomes for the population? We don't know, because we just got soda taxes in place. In fact, most of them in the United States are like less than a year old. So I have no idea what they're going to do for long-term health outcomes for populations. Should certainly watch and find out. Jonathan Zekel, open enrollment is now going and plan on having a family the next year. What should I look for? Is out-of-pocket max the only thing? If you're going to have a baby, you're likely going to hit the out-of-pocket max, because I bet you're going to have a nice hospital stay, and giving birth is expensive, and you're going to have all kinds of other stuff go on, and that's if everything goes in terrifically well. So this is one of those instances when you could theoretically look for a lower out-of-pocket max, because I think you're going to hit it. On the other hand, if you still think, it just depends too. I mean, I assume you're going into the exchanges. Like in my work, I go with the high deductible healthcare plan because that makes the most sense, even though my expenses are high just because of the way the plan is set up. In the exchanges, you got to look at the individual plans. I can't unfortunately tell you what's available in your state, what the best decisions are. This is when, if you worked for healthcare triage, I would sit down with you, or if you were a friend of mine, as I do with many of my employees, and I would go through all the plans and could decide which one is best for you. Some people call that a navigator. I perform that duty for friends and family and people that I know. Unfortunately, I don't know you, but you should find someone who does understand health insurance and let them help you make the best choice for you. Gwendolyn H. Why is it so hard for some women to lose weight while breastfeeding? The weight just melted away stories drive me crazy when I have to fight tooth and nail for every half pound. If you've watched Healthcare Triage for any period of time, you know that I'm going to say that nutrition is an incredibly individual thing. And what works for one person does not work for another. And just because you hear stories doesn't mean the same thing will happen for you. I would not in any way think that breastfeeding is going to necessarily make the pounds drift away. You know, people think it does because just by common sense alone, it uses up energy. And if you're using up energy, then theoretically you should lose weight. But the problem is, again, the body's incredibly good at compensating. This is why exercise doesn't work either. Because after your body knows you're burning off more energy, it convinces you you're hungrier and you eat more. That's why exercise is not the key to weight loss. Neither will breastfeeding be. Because as you're burning off more calories by breastfeeding, your body will make you likely hungrier. So remember, it's all nutrition. Or almost all nutrition. It's all more on the nutrition and what you're eating side than it is on the ways that you're expending energy. Think about that. On the other hand, you just had a baby. Don't freak out so much. This should not be your number one area of concern of like how much weight you're losing. Focus on the other things that are important at the moment. That's my 2 cents. Hi, Dr. Aaron. What are some ways you'd recommend to fix and improve Medicare? Oh, wow. Again, we're going to have so much to talk about in the coming years. So, premium support is going to be the way that the Republicans are going to try to do it. Otherwise, that's also called privatization. But the idea is going to be that instead of a defined benefit that you're going to get this every year, they're going to do a defined contribution where they give you a certain amount of money and then you're expected to pay for the rest. There are good ways to do that and bad ways to do that. And we will discuss them, I'm sure, as time goes on. But what do we mean when we say fix and improve Medicare? I mean, if we're saying fix Medicare, what is the thing? Are you talking about improving its long-term fiscal outlook? Because the Affordable Care Act did that. I know Paul Ryan just said recently it did not, and it may have brought about its demise sooner. That is not really true. It made the Affordable Care Act and all its machinations made a couple of changes that actually significantly extended even the time until Medicare goes broke, or until the trust fund runs out, or whatever you want to think about. And that is still years in the future. So can we find ways to reduce spending? Sure. Things we've discussed even in the past, talking about, changing how we pay for drugs, reforming that to make them more class-based. And of course, I'm blanking on the exact term right now, but we just did an episode recently on, how you can class drugs and pay for them differently that actually might spur different kinds of innovation or incentivize the right things in drugs. It might put some things more on out-of-pocket costs, but they'd be the right things in out-of-pocket costs. There are lots of ways that we could try to improve Medicare. Debating them and talking about them openly would be a great idea. We'll see if that happens. Zach Smith, are there any proven benefits of a baby infant child seeing a pediatrician over a regular family doctor? I ask because my wife and I are in the hospital about to give birth. Proven benefits? No, nothing in studies. I have many friends who are family physicians, and I think they are excellent doctors. I have many friends who are pediatricians, and I think they are excellent doctors. I know doctors of both sorts are also not so good. So it's more important that you get a good doctor. I think there's a pro and con argument for both family physicians and for pediatricians. You should pick the one that's right for you. So that's your choice. I will say, if you yourself are not seeing a family physician, I think makes more sense if the whole family's going to commit. Like if you're going to go see an internist but send your kids to a family physician, why are you doing that? So I would think more along the lines of making a decision for the family one way or the other. Mythology fan, do you agree with animal testing in medical science, or would you rather see other less cruel methods? I don't know how you do medical science without doing animal testing. I think we could sometimes be a little more careful with what we're doing, but I think a lot of people already are very careful. At some point we have to test the drugs on animals, or else we could have really bad problems happen to human beings. And most people I know, even ethicists, would agree that doing the kind of testing we need to see if a drug works or if it's harmful is sometimes better on animals than it is on human beings. Do I think we should be testing all kinds of cosmetics and everything else willy-nilly in animals? That's much more gray, and I'd say probably no. But for true out medical science, what else would you do? The alternative is not to test this stuff until it's on human beings. Then who are the volunteers? Especially when we're talking about safety. Kids, would you ever allow that? Would you ever allow us to test drugs on kids? And then what are we going to do? Just wait until the near death and then test them? And then we'll never know what the true harms are because you have to do pretty big studies. So I don't know a better way to get around some of it without doing it. Could it be less? I'd like to see them all be as less, at least cruel as possible. But I don't see how you could get around not doing it at all. That's me and my personal opinion. Terrence Foster, what does listening to me breathe deeply through a stethoscope really do? Well, it's the best way we can sort of listen, get your lung function without exposing you to radiation and doing all other kinds of invasive tests. So, we're listening for wheezing, which would be, lower airway constricting, more like asthma. We're listening to make sure that your lung sounds are equal, to make sure that we think your lungs are equal and formed, that they're fully expanded. We want to make sure we're not hearing any kinds of other like crackles or whistles or pops that could be indicative of other types of pulmonary dysfunction or lung disease. And sometimes they're listening to your heart, which is a totally different story. But when you're breathing, it's just to make sure that your lungs sound like they're functioning equally and importantly, and that we're not hearing anything that's concerning. When we're doing it for people with disease like asthma, well, then it's like for airflow to hear if you're wheezing, to hear if there's a problem. Same thing with bronchiolitis. That's really it in a nutshell. The Pretender. Is there any truth to cheat days parts of diets where you can eat anything you want as much as you want once a week, having a positive effect on weight loss efforts? That's think The Rock's cheat day. All right. By the way, have you read that article on like what The Rock actually eats in a day? Because it's insane. And I'm not saying insane like he's crazy. Clearly it works for him. But it involved a huge amount of one kind of fish. I wish I could remember what it was, but it was awesome. I don't think The Rock's diet probably works for everyone because it's a huge amount of calories, even on the days I think he's not on a cheat day. But that man clearly has a different body size and makeup and metabolism and everything, then that's not everyday people. In the same way that you should not likely be eating Michael Phelps's diet, which is like also probably off the charts. So if you're asking about cheat days in general, I know people that swear by them, I know people that don't. Most people I know who do well with that, though, are incredibly rigorous on the other days. And so it's very unlikely that a day screws you up if you're incredibly rigorous on all the other days. But I don't know many people who can hold to that. Usually when people are like, I want to have a cheat day, they're also cheating on other days as well. But again, no proof. If it works for you, I'm all for it. One more question because we're out of time. My pediatrician won't do allergy testing for my 2-year-old. He said to do elimination diets instead. Is that better? Should I find a new pediatrician? Oh my God, that totally depends on the specifics of your case. Sometimes allergy testing is warranted and sometimes it's not. You don't just go do allergy testing willy-nilly though, because you have to remember when we do it, you can only do it for certain things. We can't test for every food under the sun. They can test for like certain things we know to be true. So that if you had a completely negative allergy test, that won't mean that you're not allergic to anything in life. It just might mean we didn't test for that thing. So I don't think it's wrong to say, why don't you try an elimination diet first? Because you may find that it's something that they wouldn't be testing for. And so the elimination diet is more specific to you and what you're doing in daily life. And that will help you find the thing that it might be that we might not otherwise test for. It also may be that, that your pediatrician thinks that the level of allergies and the symptoms you're seeing don't warrant allergy testing. That like they're low level enough that that's not what allergy testing really looks for. Plus, when you do allergy testing, when you do all testing, you sometimes find false positives or things that are positive but aren't real. In other words, what if we find that like, oh my God, it says you're allergic to nuts, but that's not what was causing the symptoms in you. Now you're going to eliminate nuts and you're still going to have the symptoms. So there's reasons not to do it. So I wouldn't necessarily go find a new pediatrician. I do think it's reasonable that you ask this question, though, of your pediatrician. Get an answer from him or her to find out what that person's thinking is. And if it doesn't sound reasonable to you, then it's okay to ask for a second opinion. Let's stop there because we're over time. Thank you so much for tuning in. Brave new world here at Healthcare Triage, and for all of us for that matter. Keep watching in the coming weeks, months, years, because we are going to be talking a lot about what's going on in health policy and healthcare reform in the United States. I'm sure there's going to be a lot of meat for us to get into. We've got great episodes coming up in the near future on all other kinds of subjects as well. We will do a Healthcare Triage News on Wednesday. Next week, however, all bets are off. It's Thanksgiving week. No live show, no news. We're taking the week off. We will have regular Healthcare Triage on Monday. Tune in the week after that, however, when I believe we will be back. As always, thanks for watching. Support us if you can on patreon.com/healthcaretriage. Buy some merch at hctmerch.com. Watch Healthcare Triage. Check out the Facebook page, all those other things. Thanks so much for tuning in. We'll see you after Thanksgiving.